Hi guys, I am Dr. Zeba. You can call me Dr. Z. And so welcome to my channel, Dr. Z, the AIIMSified WombWhisper. I am here to simplify obs and gynae for you, to empower your mind in the branch of obs and gynae in AIIMS style. So a little about myself. I have done my MBBS from Medical College Kolkata, and then I did my post graduation in obs and gynae from AIIMS New Delhi. I have completed it in this year only in January 2025, and in my final year MD exam I had been a topper and distinction holder. And after that I came back to my hometown Kolkata, and it's nearer to my hometown. I have joined as SR in the Department of Obs and Gynae at AIIMS Kalyani. So why this channel and who are my target audience? So my target audiences are like MBBS student, as in your sixth, same, eighth, same, or in your final year, you people have your obs and gynae postings, and you need to learn about how to take history, how to examine patient, ANC patient and gynae patients. You need to know about some, common cases at least, like diabetes, hypertension in obs patient, like AUB infertility in gynae patient. And you need to know about your theories also, because you have to write theory papers and then give your practical exams. So first they are my target audience, and then residents, junior residents, be in MD or MS or in DNB colleges. So they, because I had been a junior resident myself at AIIMS, and I know all the hurdles we have faced during our residency, because obs and gynae is a demanding branch. Why we are here in this branch? Not because by any force or like we just pick it up by any chance, but because we love this branch. You cannot be in this branch by force. You have to love this branch to be in this branch, because it is demanding in so many levels. It demands you in both physical, mental, and in your even at your personal life level. Uh, so we are very much, I can say, frustrated on ourselves only, mostly in first year, because we think, okay, we have so much, lots of works to do, paperwork, clerical work, or here and there, and we don't get any time for studying later side our personal life. So we feel like, okay, we studied so much, we cracked PG entrance, and we entered the residency, and after entering residency we feel so useless. I have myself felt so useless and worthless and like dumb in my first year, because I could not read, I could not get time to open books. So it has been very difficult. In second year also somewhat we are like that. In third year we have to study, because we have to give exam and we have to pass, so we have to study. So I am here to make it easier for you, because what I have learned in my PG days, learning should not only be by books, because sometimes like when we open our standard books like Williams or Novak's or Sperops, the chapters are so long, and we just you know we just get lost after reading from one page to second to third page, and we never finish the chapter. It seems so overwhelming, and we feel like, okay, we cannot study and all. So I'm here to make it easier for you guys. I can tell you what to study, where to study, how to study. I'm here to teach you myself, because I like teaching so much, and I like studying so much, and I'll try to make it easier for you, so you can learn it actively, whether you are walking or sitting idle, or you have time but you don't feel like studying. So you can just watch my videos, you can make some notes or add to your already made notes. So I'm here to help you guys. So senior residents, because I'm being myself a senior resident, and I also need to be updated with all the concepts, and with all the cases. Like we see cases in OPD, we have to manage those ANC patients in ward labor room, and then gynae patients in, we have to prepare them, and we have to take them to OT, manage cases post-op. So for all that we need to know about our cases all in and out. So it's important for senior residents also, and any other healthcare professionals, be it nursing officer or anyone preparing for obs and gynae, and anyone who is curious like me about the science behind the womb. So I'm here for them. And why this channel? Because I am making this channel because I am passionate about teaching. I like to teach, so I am starting this channel for teaching you guys, and also to keep myself, if we don't teach to others, so we may forget it faster. So I want to forget it slower, so I'm going to teach you and retain it for a longer time in my own head. And I'll try to make you learn concepts and make it easier for you to understand those concepts. Okay, and it will be somewhat exam oriented mostly, because it will help you prepare for your exam simultaneously alongside helping it in your clinics. And you should learn with clarity, you should think clinically, because obs and gynae is all clinical. It's both medicine and surgery. You have to know the medicine topics also, and you have to know the surgical things also, like surgical steps, why we are taking this step, why we are tying this artery, why we are going into that space, which things to remove, what is the significance of those steps. So you have to learn the surgical aspects also. Okay, and I am here to whisper the wisdom which I have gained from AIIMS New Delhi during my residency in the AIIMS way. And how is it different from others? Firstly, because it is free, obviously it will be free only. And I feel like sometimes, like when I was preparing for my PG entrance, before giving INI or NEET PG, I had taken some subscription, like you all must have been taken, and alongside that subscription I used to watch free videos like available from different channels. And at some point or other point, I think that those free videos have helped me so much during my exam time, like has helped me cracking the exams, has helped me during my residency time also. And short duration, duration is important, because we get too lost, we somewhat get lost if the video is too long. Just something or other just comes into our mind and we get lost. So I'll try to keep it short and crisp. And learning actively helps to retain concept for a longer time in our mind than reading passively. So if you are bored, or if you don't want to learn passively, you can learn from this channel. I'll try to cover syllabus. I'll try to teach and cover topics in such a way that it covers your syllabus in both theoretical and practical aspect, and case discussion, which forms a major part of study curriculum in both MBBS and during PG residency or DNB, or during DNB for DNB residents also. And try to cover the recent updates also, because every now and then some other, or some any new concepts are just coming, or updates are coming in one topics or another, and we should be updated with those. So I'll try to cover those recent updates also. And how will this channel benefit you? Firstly, learn even when you are busy. My guide during I had my guide during my PG shift. Ma'am used to tell every one of us, like every resident, that we should always keep learning, even if it is for 10 minutes a day. We should always, no matter how much tired we are or whatever we are doing, we can, suppose you have 24 hours duty, you can take at least 10 minutes. If you are getting, sometimes it won't get even that 10 minutes in 24 hours duty, when the centers are so loaded with patients. So even if you are getting 10 minutes in your day, you should learn. And if you don't want to open your books, or don't want to open your notes, you can just listen to the video, and as per your requirements, as per the topic you want to learn. Like you have seen one case in the ward, and you want just a quick run through. Okay, in this case, how we make the diagnosis, how we manage the patient, how we do maternal and fetal monitoring, and how we progress, like how we monitor the patient weekly, or in what way, and how to deliver, then how to monitor further. You can just go through one of the videos and just see it in very short time. you can listen with, you don't want to do passive learning, you can listen to the video before starting a chapter, so that you know, okay, these topics are very important, I should go through these headings in the chapter. And even after reading a chapter, you can come back to the video and see if you have covered these points or not, because I'm not going to read books in the video, I'm going to teach you and tell you what points you should know, what points are important for you both clinically and exam wise. Okay, and you can make notes from the video itself, or if you have notes, you can, you know, add in those notes whatever I am teaching. So welcome to my channel, the AIIMSified WombWhisper, a space where I will try my best to simplify the complex concepts in obs and gynae and decode clinical cases and empower you. Okay, so subscribe to my channel for weekly videos. I'll try to put up weekly videos. I'll start from basics like history taking, examination, and then I'll move forward along with cases and new chapters. So just subscribe to my video for weekly insights, and please like, comment and subscribe. Thank you.